Hello, and welcome to Peak Life. My name is Cottrell Lewis, and I'm a peer recovery specialist at Chesapeake Integrated Behavioral Health Care. And today, we're here to talk about peer recovery services. And I'm joined by Stephen Hills, a peer recovery specialist also. Steve, tell us a little bit about peer recovery services.
Well, Cottrell, thank you for having me here with you. I'm really excited about it. And before I talk about peer recovery services, let me just talk a little bit about what a peer recovery specialist is. Peer recovery specialists are people who use our own lived experience with either mental health issues or substance use issues or both co-occurring to come alongside people and support them in recovery, like we found recovery ourselves, to help them find not exactly the path that we took to recovery, but their own path to recovery. We do that through a variety of different means. We do one-on-one services where we come alongside people and put together recovery, resiliency, and wellness plans to help them identify their own recovery goals and also the path they want to take to get there and the ways we can support them to do that. Cottrell, I know you and I facilitate WRAP, Wellness Recovery Action Plan, together,
Yes.
which is all about helping people find wellness tools for their recovery, supports to support them in recovery, a daily plan that they can use to maintain their recovery, and also action plans for when the inevitable stressors come in life or when cravings or mental illness symptoms flare up, to help them live a life of hope and recovery. Cottrell, I know you are very busy in drug court, both supporting people in the drug court program and also being a peer voice at the table, and also facilitating moral recognition therapy.
Yes.
To help people take steps toward recovery, and also working with people with GIPR surveys to help
Yes.
bring in funding to help support people with opioid use disorder in their recovery. We also have Christine Winter over at Emergency Services, who will meet with people and support them, be a caring voice at a very scary and hopeless time in people's lives, and also give them resources for the way forward. And that's just a few of the things that we do with peer recovery services.
Yes, and peer support services is very intentional, and we use our lived experience to help others, unlike clinical.
Yeah, exactly. If I were a clinician, I would have to be very circumspect in how I share my lived experience, or not at all. But we know as peer recovery specialists, our lived experience is the distinctive we bring to the table. And so we use that in an intentional way to connect with people, to build bridges, and to help support them on their own recovery path.
Yes, yes. So we're here to talk about the Year of the Peer 2023. What is that?
Year of the Peer 2023 is something that I'm really excited about. It was actually developed last year through the Recovery Leadership Academy for Peers as a peer initiative. It's developed by peers for peers. And the mission of Year of the Peer 2023 is to celebrate champions of recovery, unify peer recovery specialists, and build bridges of understanding with clinical colleagues, community partners, and organizations across Virginia. Peer support for me has always been about connection, whether it's with people or systems. And so this will help us connect on a variety of levels, not just for peer support as a program, but also to bring recovery to places that maybe we haven't been able to reach before. I know when I was very much in my depression and my own mental health issues, I had no idea what was out there. I had no idea the supports that were there. And I love that through this we can be intentional in bringing recovery to a variety of places so people that don't even know the options that are there can be exposed to those.
Exactly, and we'll be bringing our community partners in.
Right, we'll be partnering with a lot of different people and organizations to bring that in a variety of creative ways, just as we're doing right now with Chesapeake Television.
Yes, yes. So why is Year of the Peer so important?
I think it's so important because it really is about building that connection. You know, it is about really bringing peer services to the forefront, showing who we are, what we do, so people know that that's available, that there are people that they can partner with in recovery, but also so that we can engage the community in a lot of different creative ways. And again, like where I was, where I didn't know what was out there. I didn't know recovery was an option, to show them that recovery is an option.
Yes, and I'm very excited about all the events and activities that'll be linked with showing the community exactly what peer services is about.
Yeah, definitely. So please stay tuned as the year goes on, because there's going to be a lot coming out in a variety of ways, including what we do here with Chesapeake Television.
Yes, so this is going to be an ongoing segment.
It is, yeah, I'm excited about it.
What are we going to be talking about?
Well, what we're going to talk about is, at the start, a variety of a Year of the Peer, monthly peer recovery themes. And so we're going to be addressing topics like advocacy, how to speak up for yourself, being authentic in recovery and finding your own path, collaborating with others in recovery, whether it's how we do it, collaborating with different people and systems, or in your own recovery, finding those natural supports and partners, connecting with others, diversity, how, you know, we are all very diverse. We all come from a different background, and honoring that. Empathy, equity, looking at fairness and justice, innovation in approach, motivation for recovery, I know, which was something that was hard for me at the beginning, but support really helped with that. Also looking at multiple pathways, that it's not just Cottrell or Christine and I saying, here's recovery, here's how you do it, but finding your own unique pathway to recovery. Looking at mutuality, that we're definitely not the experts telling you what to do, but we are also people who are walking along the path, walking side by side, helping you to find your own path, and also understanding, to increase knowledge and to deliver that knowledge to others. And then after that, we'll just open up to a variety of recovery topics and themes.
Oh, wonderful. It's really an exciting time to be a peer.
It really is. I'm excited about this whole emphasis of Year of the Peer.
Yes. Well, that wraps it up for Peak Life. Thank you for joining us.